If your knees pop when you stand up, your hips aches first thing in the morning, or your shoulders feel like they've aged 20 years, stop blaming it just on getting old. That is not the real answer. And believing that lie may be costing you your mobility for the rest of your life. Hello, I'm Dr. Gundi, a medical doctor and a fitness enthusiast. And today I'm going to show you the four specific biological processes that are destroying your joints right now and exactly what to do to stop them. Stay with me because most doctors won't explain this to you. Here is what usually happens when you walk into a doctor's office with joint pains after 40. They order an x ray, they say it's arthritis, take ibuprofen, lose some weight, and come back if this gets worse, and that's it. But that's incomplete medicine because arthritis isn't the cause, arthritis is the result. The cause is four silent biological mechanisms that begins accelerating after your 40th birthday. And if you don't address all four, no supplement, no painkillers, and surely no physical therapy session will give you the lasting relief. Let me walk you through each one. The mechanism number one, synovial fluid decline. Think of your joints like a door hinge. Without oil, the hinge creaks, resists movement, and eventually sizes up. Your joints are exactly the same. Synovial fluid is the natural lubricant inside every joint in your body. It cushions impact, it reduces friction, and this is the critical part. It delivers nutrient directly to your cartilage. Here is why that matters so much. Cartilage has zero direct blood supply. The only way it receives nutrients is through synovial fluid, and after 40, your body produces significantly less of it. So what happens is that your cartilage starts to starve. It thins, it cracks, and the pain begins. And here is the trap most people fall into. They rest because it hurts. But rest makes it worse. Movement is what pumps synovial fluid back into your joint. A sedentary lifestyle starves your cartilage even faster. I'll give you the fix for it in the few minutes. Mechanism number two, and this one almost nobody talks about, is chondrocyte senescence. And chondrocytes are the specialized cells responsible for building and repairing your cartilage. When you are young, they are active, they patch the damage, they rebuild, they regenerate. After 40, these cells enter a state called senescence. I call them zombie cells because they are still alive, they are still present in your joints, but they have completely stopped doing their job. And worse, they start releasing inflammatory chemicals that damage the surrounding tissues. They become actively destructive. And what accelerates this? We have chronically poor sleep, elevated cortisol from the stress, excess visceral fat around the belly, and this will surprise you, too little movement. The good news, chondrocyte senescence is not permanent. You can reactivate cartilage repair pathway, and I will tell you exactly how. Mechanisms number three and four work together, and they are the reason your pain becomes chronic. Number three is what we in medicine call inflammaging, a combination of the words inflammation and aging. After 40, your body shifts into a state of chronic low grade systemic inflammation. You can't feel it directly, there is no fever, no swelling you can see, but it is silently attacking your joint tissue every single day. What drives it is a high sugar diet, gut microbiome imbalance, and declined sex hormone, which brings me directly to number four, hormonal decline. Testosterone is not just about muscle, it has a powerful anti inflammatory effect on your joints, including the cartilage inside them. After 40, testosterone drops approximately 1% every year. By 45 to 50, many men are chronically low and they have no idea. Estrogen, yes, even in men, also plays a protective role in cartilage health. When both decline together, your joint lose a critical layer of biological armor. And this is the moment joint pain goes from occasional to constant, not one cause, all four working simultaneously. Now, here is what I want you to understand. Everything I've just described is not inevitable. Every single one of these mechanisms can be slowed down, interrupted, or partially reversed if you know what to target. And this is what I call the J40 Joint Reset Protocol. Four targeted actions. Let's go. Step 1, move every 45 minutes. Not workout, just movement. A short walk, 10-minute body squat, stand up and sit down 10 times. Set a timer on your phone right now if you need to. Every time you move your joint, you pump fresh synovial fluid through it. This is not optional. This is the single cheapest, most effective cartilage nutrition strategy that exists. It costs you nothing. Start today. Step 2, 3 foods that scientifically reduce inflammation and support cartilage repair. Number 1, fatty fish, omega-3 fatty acid, especially EPA and DHA, directly suppress the inflammatory mechanism your zombie chondrocytes are releasing. Salmon, sardines, mackerel, eat them 3 times per week minimum. And number 2 here is turmeric with black pepper. Curcumin is one of the most studied anti-inflammatory compounds in clinical medicine, but, and this is important, you must pair it with black pepper. Piperine, the active compound in black pepper, increases curcumin absorption by up to 2000%. Without it, most of the curcumin passes right through you. Number 3, hydrolyzes collagen and vitamin C. Collagen is the primary structural protein in cartilage, but your body cannot synthesize it without vitamin C. Take 10 grams of hydrolyzed collagen peptide with 500 milligrams of vitamin C in the morning on an empty stomach. One thing I must mention, always consult your doctor before taking any medication. Now, real quick, if this video is helping you understand your body better, hit the like button right now. It tells me this is a content you need more of, and it helps any other man over 40 find it. Step 3, reduce cortisol. Remember, elevated cortisol is one of the main biological triggers that drive chondrocyte into senescence. Chronic stress is literally accelerating your cartilage breakdown. My prescription? 10 minutes of diaphragmatic breathing before bed. Slow inhale through the nose for 4 counts, hold for 4, exhale for 6. Research shows this activates the parasympathetic nervous system and reduces cortisol level by up to 40%. And here is the bonus. Better sleep means more growth hormone released overnight, which is exactly when joint tissue repair actually happens. You cannot separate sleep quality from joint health. They are the same conversation. Step 4, and this is my direct medical directive to you as a doctor on this screen. Get your testosterone level checked. Ask your doctor for full hormone panel, total testosterone, free testosterone, and SHBG. If your free testosterone is below 15 picogram per milliliter, you have a measurable biological reason why your joints are degrading faster than they should. They are proven natural ways to optimize testosterone we have. Resistant training, quality sleep, zinc, and vitamin D are your starting point. And in some cases, a clinical conversation about testosterone optimization may be appropriate. But that conversation must start with you knowing your number. Don't guess, get tested. Let me leave you with this. Your joint after 40 is not just aging, it is a result of 4 specific measurable biological processes such as synovial fluid decline, chondrocyte senescence, inflammation, and hormonal shift, all accelerating at the same time. But now you know, and knowing this changes everything. The J14 Reset Protocol isn't about managing pain, it's about giving your body the biological environment it needs to actually repair. You are not old, your joints are not finished. You just needed the right information. If you want me to go deeper on the testosterone and the muscle connection, especially how low T is silently accelerating muscle loss and the joint damage together, I have a video right here that will completely change how you think about aging after 40. Click it, don't wait on this one. I'm Dr. Gundi, age on your own term. Thanks for watching, and I'll see you in the next video.